Welcome to Module 15, Discharging from the BDAP. You will use the BDAP discharge form in REMI when a client no longer meets the eligibility requirements of BDAP, a client has passed away, a client requests to be discharged, or a client has not completed their annual renewal within 60 days of the due date. However, BDAP will instruct you to submit a discharge request in those circumstances. When discharging from the BDAP, you must include if a client is requesting a 30-day discharge supply while they're setting up care elsewhere, if a client is terminating or keeping their BDAP-sponsored insurance, if applicable, and if a client is terminating or keeping their Ryan White Delta dental coverage, if applicable. If a client is also being discharged from case management, you would use the discharge form that's labeled BDAP and client services. So here's an example of an BDAP only discharge. You would choose under application type, discharging from services, and client is discharging from BDAP only. Then the discharge details will auto-populate, and you'll include BDAP only discharge reasons. So some of these reasons could be the client has active Medicaid, the client did not recertify, the client did not fill prescriptions, the client is over income for the program, the client has entered into incarceration, the client has requested that they be discharged from the program. And on this right-hand side, you can see that we ask you to confirm that a client has terminated their coverage if they're on ASI, if they'll keep their coverage and pay for it themselves, or if this is not applicable because the client was not enrolled in that insurance type, and the same would be under Delta Dental. And here in the discharge notes option, this is where we would be asking you to confirm if a client needs a 30-day supply or reasons around the discharge, such as client is relocating to Wisconsin and has an appointment with their provider, but will need a 30-day discharge supply of meds in order to tide them over until their first appointment with their provider. So here's an example of this section filled out. Client has requested to discharge from Iowa BDAP as he's relocated to Wisconsin. The client had ASI and Ryan White Delta Dental, and the case manager terminated both of them effective May 31st of 2025. The client was given referral resources for AIDS service organizations and HIV care in Wisconsin. The client is also requesting a 30-day discharge supply while he waits to establish care in Wisconsin. And that is a simple discharge summary. There may be times when a client is listed as in process at the time of discharge, and you may also upload supporting documentation to simultaneously remove the client from in process and discharge them at the same time. So this is how that would look on this screen. You would indicate, just as we did in the previous example, that the client's requesting to discharge and why. But on the next screen, you'll be able to see more about the remove from in process piece. So when a client is listed as in process and you're removing from in process, it will auto-populate with this remove from in process field. And from here, you would copy or upload documents over. So let's say, for instance, the client was in process, they were pending Medicaid, or they needed to provide new pay stubs or verification of their residency. You could use these corresponding fields here and upload and attach the documentation that's required in order to remove the client from in process at the same time as the discharge.